Okay, I'm very happy to see you again in the Diseases of Breast class. I'm going to deliver the section 2, and I'm from the First Hospital of China Medical University, the Department of Breast Surgery, and very happy to see you. I'd like to introduce the breast imaging, which is very important and contribute a lot in the treatment of breast cancer. It is called screening mammography. It is performed in asymptomatic women with the goal of detecting breast cancer that is not yet clinically evident. It is widely used in Europe and North America, which contributed a lot in reducing the deaths of breast cancer. This table showed several trials on breast cancer mortality and false positive mammograms by age group in breast cancer screening trials. And we can see the patient with age from 40 to 70 benefits a lot from the reduction of the mortality, especially for the patient over the year 60. So it is strongly recommended annual mammography if the patient is over 60. It is also recommended all the women over 40 receive mammography annually or every 2 years. Here we show the screening mammography, the picture of mammogram, and the equipment to do the mammogram. It's an X-ray equipment. They have 2 compressive pads and squeeze the breast and take pictures. The figure 1 showed a normal type A breast, which is commonly seen in menopausal women. We can see the involution of the breast, only some connective tissues scattered in the breast, and the breast is replaced mostly by the adipose tissues. It is a normal, healthy breast. There's no tumor or lesions. And the figure 2 showed a stellate mass in the breast. It is not a good lesion. The combination of a high-density spiculated borders and distortion of the surrounding breast architecture suggests a malignancy, and then be proved by the pathologic diagnosis. It's an invasive ductal carcinoma with poorly differentiated. The figure 3 showed the clustered microcalcifications. We can see the fine pleomorphic and linear calcification that clustered together, which suggests the diagnosis of ductal carcinoma in situ, and then be proved by pathologic diagnosis. It's a non-invasive malignancy and have very good favorable prognosis. And in America, about 1/3 of newly diagnostic patients are found with microcalcification and then diagnosed with the diagnosis of DCIS, ductal carcinoma in situ. Another very important breast imaging is ultrasonography. The ultrasonography is useful in determining whether a lesion detected by mammography is solid or cystic, because the mammography is hard to tell them. And the ultrasonography can also be useful for discriminating lesions in the patients with dense breast. In Asia, it is widely used, but in the Western world, it is not so common as mammography. However, it has not been found to be a useful screening tool because it is highly dependent on the operator performing, and there is a lack of standardized screening protocols. By the way, it is not a hand-free examination. It is not very suitable for large population screening. And figure 1 showed the image of a breast cancer, a very small lesion. The mass is solid, contains internal echoes, and displayed an irregular border. Most malignant lesions are taller than they are wide. The figure 2 showed ultrasound image of a simple cyst. By ultrasound, the cyst is round with smooth borders. There is a paucity of internal sound echoes, and there is increased through transmission of sound, with the enhanced posterior echoes. While in China, women have smaller but more dense breasts, so ultrasonography is an equal and essential examination. And the last breast imaging I will introduce is the magnetic resonance imaging, which is very expensive and take a long time to do that because the MRI of the breast needs enhancement. MRI is increasingly being used for the evaluation of breast diseases. It is useful for identifying the primary tumor in breast in patients who present with axillary lymph nodes metastasis without the found of the primary tumor, because MRI has very high sensitivity. MRI may also be useful for assessing the extent of breast tumor, particularly in young women with dense breast tissue, and for evaluation invasive lobular cancers. Because the invasive lobular cancers is hard to detect it by sonography or mammography. The sensitivity of MRI for invasive cancer is higher than 90%, but is only 60% or less for DCIS. So the mammography still plays the most important role in screening. The specificity of MRI is only moderate, with significant overlap in the appearance of benign and malignant lesions. The figure of breast MRI showing gadolinium, the enhancement, the contrast, show this contrast enhancement of a breast cancer. The rapid and intense gadolinium enhancement reflects increased tumor vascularities. And lesion quarter and size may also be sized by MRI, and it has a more accurate estimation comparing to the sonography. After detection of the suspected lesion, the next step is to have the definitive prognosis, which we need the tissue to do the pathological examination. There are a lot of breast biopsy methods. The first is the fine needle aspiration biopsy. It's a common tool used in the diagnosis of breast masses. It can be done with a 22 gauge needle, so it is very convenient. The shortage is the aspiration must be probably prepared on a slide for cytological examination. The tissue is too little. So we developed another biopsy method to have more tissue, to get more tissue. The core needle biopsy can obtain more tissue, which makes immunohistochemistry examination feasible to get definitive diagnosis. But in the pathologic diagnosis, the more tissue you get, the more accurate you will get. So the vacuum-assisted biopsy is developed to do better and to accomplish the excision of the whole lesion. The biopsy with imaging guiding greatly improved the accuracy. The diagnosis of breast lesion use a minimally invasive procedures, such as core needle biopsy is preferred approach. But in some cases, the excision biopsy is needed, especially for a wide lesion with diffused atypical ductal hyperplasia, and the congenital biopsy, even the vacuum-assisted biopsy, will underestimate. But the use of excisional breast biopsy as a diagnostic procedure in most cases increases patients' costs and pain. So it is the end of the section 2, and I will be glad to see you in section 3. And thank you for your attention.